of Rural Seeds is so that more young health professionals are encouraged to go to work into rural. So it's about connecting students like yourselves to young people who are working in rural, so that they can tell you more about it, share their experiences about it. And hopefully by listening to their experiences, you'll be like, I'm actually quite interested in this. Or you'll just have that feeling that this is something that you also need to be part of. So we're hoping that this session will do exactly that for you, that it will inspire you to go into rural, it will inspire you to be more curious about it, and will also inspire you to, find out about other things other than the traditional route once you graduate. So the Rural Seeds Cafe was actually started by Dr. Mayara Floss, and she's a Brazilian doctor. She's a poet, she's a writer, she's a film director as well. And she's also quite passionate about planetary health. So we're so lucky that she's able to join our conference this year. And she's physically at the Rural Health Conference in Oudtshoorn. So we'll be hearing from her as well towards the end of our program, just so that she can give the closing word on for this Rural Seeds Cafe. But what we have on our program for today is that we'll be having a panel discussion with 4 panelists, and our panelists consist of a medical doctor, a physiotherapist, a professional nurse, as well as a clinical associate, and they'll just be giving you more information about why they went into rural, what the rural experience has been like for them, as well as things they wish they had known before going into rural. I think there's quite a lot of universities that focus on rural, and they may have rural electives, but not a lot of universities have that. So not a lot of students are exposed to rural. So through this type of engagement, Rural Seeds Cafe, we're really hoping to increase your exposure to rural, where you can hear from young health professionals like yourselves, or like your future selves, who have gone through this journey, and perhaps you can relate to it, because we have quite a multidisciplinary team, quite a multidisciplinary panel discussion. So we're really hoping that they can share more insight into the rural experience and things they wish they had known before going into rural. So once they finally connect with us, we'll be ready to get the conversation going. But we've already, Dr. Anna Jacobs will be joining us online. So she's here with us. And once I receive word from Oudtshoorn that they are ready, then we can get started.
Yes. Bulahi, can you listen us? We are
yes, Dr. Mayara, I can hear you.
Okay, good. Good to meet you.
Thank you so much. Nice to have you here. Nice to finally connect with everyone. Zoom and technical issues are always a thing. But I'm really glad that we're able to connect today.
Absolutely. Can I add some points?
No problem. Yes, please.
Yeah. Can I just suggest to everybody that has Twitter to use the hashtag Rural Cafe, so we can talk as well on Twitter about what we're discussing here. If you have there is no internet. Can you help us with getting the password for people connecting? That's quite important. There's a lot of people here that I want to hear what they think about what should be talk, or that we should also tell people about why go rural and what you need to know maybe before go. So can I suggest that we try to make it a little bit short so we can have more time to have a conversation?
Yeah. Great.
So
cool.
Back to you.
All right. Thank you so much, Dr. Floss. So, as I mentioned, we have 4 panelists today. We are joined by Dr. Anna Jacobs, who's joining us online, and she's a medical doctor. And our panelists who are joining us from Oudtshoorn are Warren Hansen, who's a professional nurse. We're also joined by Cameron Reardon, a physiotherapist, as well as Nompumelelo Mahlambi, who's a clinical associate. So to keep things light, I'd just like you to all introduce yourselves and perhaps just state like which university you went to, what you did afterwards, and where you're currently working now. And I'll start with Warren Hansen. You can take the floor.
Sorry, can you hear us?
Yes, I can hear you. Were you able to hear me?
We did drop for a little bit. I don't know if you want Anna to introduce herself first and then we can go.
All right, no problem. So Anna, you can introduce yourself and just like add, which university you went to, what you did afterwards, and where you're currently working now.
Okay, perfect. I don't know if my face is showing. I don't know.
Yes, it is.
So I studied at UCT, finished in 2019, and then did my internship in Joburg at the Helen Joseph. And then this year I've been at Tonga Hospital for the past 8 months in Mpumalanga. Yeah.
All right, nice to meet you. Thank you for joining us.
You don't teach us, right? Are we busy or something? Oh, yeah. When we done.
And Cameron, can you still hear me? All right, so I'm not sure if who we're hearing is from the Rural Health Conference, if they're actually a panelist. But can I just get confirmation from Cameron if you can still hear me? All right, I see that.
And Victoria, let me just tell you what's happened is Eskom had a planned outage in Oudtshoorn today. So they've actually been running on generators all day. So although they've got electricity, the cell towers keep going, presumably because they're reliant on the solar and it keeps going.
Okay.
We are back now though.
Okay, thank you.
And there is electricity. But yes, I was saying when I got interrupted, my name's Cameron Reardon. I'm a physiotherapist. I worked rurally between 2012 and 2017 at Manguzi Hospital in Northern KwaZulu-Natal. And I no longer practice as a clinician in rural, but I'm involved in training physiotherapy students in a range of different rural contexts. So contributing to producing a fit-for-purpose rural workforce. And that's me. Warren?
No, I'll use this one. Yeah, I'm Warren. I studied undergraduate at Worcester Hospital Nursing School. So I've been in rural now for 16 years. Currently, I am a lecturer also at a nursing college in the rural area in Worcester. So yeah, I'm actually glad I'm speaking now tonight. I'm supposed to speak tomorrow. So this is just letting go of the nerves for tomorrow. So yeah, thank you.
All right, and I'm not too sure if Nompumelelo is there. She's not in the shot, but if she is there, then please may she also introduce herself.
Hi, Victoria.
Hey.
Hi, so I'm Nompumelelo Mahlambi. I'm a clinical associate by profession, graduated in 2016, and I've been in rural health since 2015. And I've been in Northwest, in Mpumalanga. I've been in the Western Cape right now. I've also been in the Northern Cape and Free State. Thank you.
All right. Thank you so much to our panelists for introducing themselves. And I really hope that everyone can connect with someone here. I mean, like, as much as Cameron is a physiotherapist, hopefully like as an OT student or, you know, as a audiologist, that you can connect to what he's saying as a health and rehab student. But on to the next question that I have for you is, what actually made you go into rural? What inspired you to think of going into rural as your next step in your career path? And perhaps we can hear from Nompumelelo first.
Throwing me under the bus there.
You have to.
So with my profession, it's basically, the profession was designed for us to be mid-level healthcare professionals, and we basically bridge the skills gap within the health systems. So it wasn't by choice, but it's a choice that, or a decision that I took that I was like happy about, and I only found out once I was in it that, hey, I actually like this. So during my profession, I love the fact that you get innovative in the rural areas. I love the fact that you're always learning something new. You can always share something with someone. There's a saying that we always say that you see something, you see one, do one, teach one. So it's something that I love. Okay, whatever skill that you have, you know that you need to refine it and you need to share it with someone. And that skill that you know, or that skill that you have, you will always have different variations of it as long as you keep the basic idea. So that's what I loved about rural health.
Shall I go next? I think for me, the things that were important in my decision to practice rurally is, firstly, I remember as an undergraduate student hearing the story of a health professional who'd been rural. And I think I connected deeply with that story, which I think is part of the value of things like this, is hearing other people's stories. And that story was very appealing to me. I'm also a sucker for a good story. So that was a big moment. And then in my final year as a student, I did an elective rurally, which allowed me to, I think, get exposure to rural healthcare issues and to be inspired by some of the people that were working in that space already. And that was a transformative 3 weeks, and then that translated into my decision to elect to go rural in my community service year. And then, just a couple of other things. I think that it sort of appealed to me as an adventurous lifestyle. I didn't grow up in a rural context, so it was something that was different and unfamiliar. And as a young 21-year-old male, that was quite appealing for me. And then I think just the opportunity to serve and the opportunity to be a part of contributing to healthcare where it's most needed was also something that appealed to me.
So like I said, I've been in rural. I'm still there since forever. So probably I must say why I'm still there. So it was easy for me to connect or relate to the culture of the facility where I worked, because I grew up also within a rural area. So the culture, the communities are small, so it was easier for me to also connect with the patients and understand where they're coming from. And you grow, you start to love what you do because you're close to the culture and the communities. So to the community outreach, to work in the community. So that's why I'm still there. Thank you.
All right, thank you so much. And Anna?
So I've been interested in rural healthcare from before I started medicine, but obviously it grew during my studies and work with. Can you hear me? Oh.
Yes, we can.
I think, the idea of knowing that you're part of a group of healthcare professionals that are serving a very neglected, isolated community, it just makes sense. I want to be a part of that group of people who are serving these communities who need us most. I think it's the other attractive things are that you are in a setting where maybe there's more room for growth, more room for really challenging your clinical skills, learning outside of the box. learning to be competent, learning to make brave decisions. Yeah.
Yeah, thank you so much for that. I think one thing that really stood out was, stories and hearing people's stories of rural health and how it's easier to connect to someone's story than it is to connect some idea of it. So I'm really hoping that as you share your stories today, that more young people will connect to those and, hopefully go into rural themselves. But I think one thing that obviously drew people to this Rural Seeds Cafe today is the topic, what I wish I had known about rural before ComServe. So that's my question to you now. Like, what do you wish you had known before going into rural? Some tips and tricks that, if you had known them, perhaps your experience would have been better or less scarier. But what do you wish you had known before going into rural?
Okay, people are pointing to me. I think I think isolation is one thing that's I think I also think that's why I created Rural Seeds or co-created Rural Seeds, because I felt so isolated when I went rural. So then I was thinking like, where is the other people? Where is the peers or and I think we need to talk about these things, and this is about like how it's important to network. So how it's important that we know each other, and then we can maybe it's not just about clinical cases, but like life in the rural sometimes is difficult. Your neighbor is your patient in many times. So to create the boundaries, sometimes if you just want to relax and not be the doctor as well, I think this was one of the challenges for myself. But on the other side, what I want to, and I discovered that if you have any problem, the rural communities are the best in the world to help you. You don't feel like isolated in the other ways, but I think it's difficult to create these boundaries. And I think, but also is the joy of being rural. I needed to left one of the communities that I was working. And I decided to borrow my father's car because it was bigger, because I need to bring some things off the office. But the patients bring so much food to myself that I still have it. Like, I think I still have like, they give me like something like 50 jam pots, like with jam, and then like also towels and things that they did. So to show how beautiful it is, like to be rural, and how grateful it was. And then at the end of the day, it doesn't fit in my huge dad's car, and was like, oh my God, where am I going to put all these things? And then I need to put in a box, and another person need to bring to the other place that I was moving. So I think this the connection and the change that you can make in a rural community, we need to talk about this in the universe, is that we are doing a huge change when we are when we decide to work in rural areas. That's for myself.
Yeah, I want to jump on the back of that and just say, perhaps as I was thinking, Myra, as you were talking, that one thing I wish I'd known about rural before I went rural is that it's okay to accept a mango when you do a home visit. And I think for me, it stands as an illustration of like connectedness and relationships that matter in rural. And while you can feel isolated going rural, you can also feel deeply connected to the people and the community that are around you, whether that's your fellow healthcare professionals, your patients, community at large. So, I think that was something that was important for me to learn and to acknowledge. I think the other thing to recognize that I wish I'd known, which would have saved me a lot of frustration in my journey, is that actually coming out as a new graduate, particularly being someone who didn't grow up in a rural context, is you know very little about where you're going. So take some time. Learning's just beginning. And I've got this image in my mind. Physiotherapists, like hands mean a lot to physiotherapists. And I think when I graduated, I wanted to be hands that did. but I didn't have eyes to see or ears to hear. And I think just being hands that do without eyes to see or ears to hear can be hands that harm. And so I think for me, what was really important is to slow down and to kind of commit myself to learning about a different way of being, a different community. So, yeah.
The keys.
All right, so what I wish I knew before I went into rural. Well, firstly, I don't think one can be like prepared for being in the rural sector simply because you don't dictate when a person is going to get sick and to what extent and what management plans you need to have. But one thing I wish I knew was the fact that health is not a destination, it's like a journey. You might think you know how to treat hypertension for one reason, an example basically. Or you might know or think you know that you know what to do when there's a medical emergency, but there's always new things to learn as you learn, basically. So yeah, that's the first, and the fact that you're always going to need to refine your skill. And yeah, thank you.
So now you know I've been there forever. So I am pro-rural, but during my postgrad studies, I worked at tertiary institutions. So what I know now is that at rural facilities, the chain of command are much shorter, which makes decision-making much easier and quicker, and which make teamwork better. However, there are challenges. Some of the challenges are human resources, equipment, and as well as support and guidance. If I can make an example, the patients within the rural facilities, like earlier we saw with Dr. Phillips, that there's one regional hospital that serves a certain region. So many of the patients come from the districts. So if they need certain specialized services, then they must travel from far. Then the transport services must cover a wide area. So these patients must be at their pickup points very early. So sometimes they make it in time, and when they do, they come or they get to the facilities with already challenges like, say for instance, they will come for a procedure like a colonoscopy. So these patients have to be staffed from the day before. And many of them have chronic diseases like diabetes, hypertension, and they do not take their medication because the NPO. So once the time comes for the procedure, they will either be hypoglycemic or have an increased hypo, yes. So, or they will have an increased blood pressure. So, and that leads to them being cancelled. Then the whole process starts over again. And worst case scenario is they never get access to the services that's available there to them. So thank you.
I just add one thing. The most creative health professionals will be in rural because we have low resources, so we're the most creative. So to create things and to do things to fix things. More recognize it.
Dr. Floss, we can't to hear you. Seems like we're losing your connection again. In the meantime, perhaps Anna, you could, just answer the question while we wait for them to connect again, which is, what do you wish you had known before going into rural?
Sure. I think my answer might be a little bit more pessimistic, but I think one of the big things I thought was going to be a challenge was what was mentioned now, low, poor resources and those types of things. But what I found to be more difficult was actually, sorry, I don't know if my connection's still there.
Yes, it is.
Okay.
I can still hear you.
Yeah, as a junior doctor, enthusiastic, just coming from an academic environment, you're so used to learning, you're so used to things being done right. It can be very disheartening to walk into a hospital where you do have MOs who've been working there for a long time, who might have a completely different approach to healthcare. And you really start to feel very alone and that you can't necessarily trust the clinical judgment of your seniors. And that's a very new experience. So I think just being aware that, yes, there's all these wonderful, amazing things to look forward to. And then also other limitations. One of the biggest things I've found is just getting past the frustrations of senior colleagues, and then just remembering that you're there to do the best that you can. And although there may be a lot of obstacles, just keep pulling on your resources, people that you've made contact with at prior hospitals, reaching out to referral hospitals, getting advice there, having all your apps on your phone, making sure that you know how to use them, and keep reading in your spare time, keeping up to date, because unfortunately you might find that you do end up in a hospital where things are done wrong a lot of the time. People are apathetic, maybe people are not coming to work. You find very dangerous decisions being made, and you can feel quite overwhelmed. So just try to, maybe go with a friend, make sure that you have one or two people that you trust there, or form good relationships with the other COMSOs or doctors that you've identified to care and really love their job. And yeah, try not to let it get you down and just keep going.
And thank you so much for providing, that point of view, that it's not all going to be like smooth sailing. You are going to come across some ups and downs. I think that's with any profession. And I think, rural is just another profession where you will encounter the good days, but there are some days that are quite frustrating as well, which is normal. But the next question that I have for you is, what advice do you have for final year health sciences students? We have so many students on this call who are sitting here and listening to your experiences, and perhaps they might have considered going into rural, or after this conversation, hopefully they'll say, I definitely want to go into rural. But in these last few months, I think especially for the final year students, what can they do to help prepare them for the rural journey? What advice do you have for them in these last few months as they wrap up their undergraduate, commitments? And perhaps, Anna, maybe we can start with you while we still have you here.
Yeah, so I think some of the points that I would suggest is just to, take in all the knowledge that you're getting now and try to become very comfortable with basic management of, basic presentations that you're going to get, and during internship to really take it in, because it can be, sorry, this is for medicine, but it can be very exhausting with your calls and all your hours, and you just want to go in, do your ward work and go out. But just remember, you're surrounded by all these specialists and people who have great knowledge and experience, and you're going to be alone the next year. So try to take all that in. Yeah, and then I mentioned the apps on your phone. It's very, new millennium, whatever, but it really does help to have all those type of apps to pull on when you need it. And then just think about how you're going to deal with difficult days. What are your ways of coping, and what are your social support structures? And yeah, when choosing places to go to, I guess either see if you can go with a friend or with a colleague, and also see where's the closest bus stop, or are you comfortable with that type of distance, because it is a really big commitment. And as much as this is something that you really want to do, you also need to keep in mind that you want to survive and you want to be happy and all those things. Yeah.
Okay, I'll go. So you have to be for learning opportunities to increase your knowledge and skills, because being at a rural facility offer further learning opportunities, but however, you will be faced with making independent decisions. So seeking for those opportunities will definitely help you with making more decisive decisions. And then further, if you want to be at the foundation of healthcare, then rural is supposed to be.
All right, and the advice that I would have for students, firstly, is don't be afraid of asking. You've got a lot of resources around you can, and it will show itself later on.
All right, so it seems like we might have lost them again. So in the meantime, I'm just going to take some
Be back.
questions. Oh, okay, cool. Sorry. All right, over to you. Nompumelelo, we just didn't catch what you said towards the end. So would you mind just repeating? Go.
I don't know which end, but I'll just start on the second point, Uguti, as a professional or as a student, keep on learning, keep on doing what you do best, and have fun. Yes, that was the most important thing. Have fun while you're doing that, because it makes you happy. You have that positive energy, and it rubs off on your patients. It rubs off on your colleagues as well. So when they see a professional who is at work, who is happy doing what they're doing, it's a very good space to be in. And for your patients, it's a good starting point for restoring health and wellness. Amen.
I think for me, the first thing would be for students considering going rural. My first piece of advice would be to do it, be bold and do it. It's had a profound impact on me. It's changed who I am at a deep level. I kind of cringe when I look back and think who I was at 21, but and maybe I'll do that in the next 10 years as well. But yeah, to do it, to immerse yourself in the experience beyond just the clinical experience, to really experience life within the community. I still remember a very disorienting experience for me early on in my rural life was being handed a plow in Mum Jay's garden and asked to plow. So and on that quickly cultivate a sense of empathy in you. So immerse yourself in the experience. Recognize that there are those that go on. So I think the value of networks, and try to seek out certain points. Take time to in relationships, build relationships, and it's time for trust to develop.
I think I would just want to remind everybody that's watching and hears, and if you got like doctors that work there, it's just 24% of the doctors that decide to work in the rural areas, and this is 30 something of the nurses. So I'm sorry, I don't have the other data, but that's one that I know by heart. So how the world world now. That's quite.
All right, we seem to have lost them again. So, we really want this to be as interactive as possible, and we want to hear from you if you have any questions to ask the panelists today. So, if you have any burning questions, perhaps you can type them in the chat, or you can raise your hand and, we can hear from you. If you have any questions that you'd like to ask the panelists, anything at all, and then, once we connect to them again, they're able to get that across to them.
I don't have any idea if I'll be able to repeat this, but I think that's from my side.
All right, thank you so much, Dr. Floss. I was just saying that when you were disconnected, I was just asking if there's anyone on the, in the audience who has any questions. So I see that Shamiko has her hand raised. Sure, you can unmute yourself and go ahead and ask your question.
Hello. I just wanted to ask with regards to driver's license. I heard from someone that going into rural, it is recommended that one has a driver's license. But I do not have one at the moment, and I know it'll take some time to get one, so it's not very realistic for me to think I will just get it now. How will that work? So that's my first question. How necessary is it to have a driver's license? And secondly, how much should one save or go into the first month of ComServe? How much should we have in terms of money now, just so that we know if we need to save, how much we would need to save for ComServe? Because I presume it's not the same, obviously, as being in the city or in a town. So I don't know how much will one need to spend on transport and such. But yeah, those are my two questions. Thank you.
All right, so Nompumelo is going to answer. So I think take things one step at a time. You are not there to drive, you are there to go learn and to see patients and to gain clinical skills in a rural area. So be that person. Don't worry about driver's license and all of that. Those are things that really I wanted in the rural area, but I didn't mind walking to the shop, and I wasn't walking alone. I was walking with the students that I was with. So immerse yourself in that experience. In terms of how much you're going to need, you'll see when you get there, but just focus on the first thing that you need to do when you're in that rural space. Cool.
Thank you so much. Sorry, I'm just one of those people that try to plan just ahead of time, just so that I'm not stuck or that I don't need to rely on my parents to send me anything. So I just, that's why, not because I don't want to immerse myself in it, but thank you so much for answering.
Thank you so much for your question, Shamiko. Does anyone else want to take a jab at it?
Okay. So just saying to
So I think you guys are cutting off. I
Still
can't hear.
connected, yeah.
Sorry.
Can you hear me?
Yes.
Bukhari?
Yes, Prof, we can hear you. We can't hear you now though, but we can, I see the pictures back.
Okay, shall we repeat again? No.
Yes, please.
Okay. So have you heard anything like from what I said before or not? Need to get
No,
worried about you have tips for you? Hope yes. No, you haven't. Okay, so I will do
Sorry.
it again. So I'm
Okay.
okay. No worries. It's just that the internet's funny. I'm really sure that the students that are going rural, the community know the value of that. The other colleagues on the rural healthcare teams also know the very supportive places. So this is what we were listening about, having fun and also enjoying to be rural, because it is a joyful journey if you can see the joyful part of it. So I'm very sure that you find like people to support you and you a lot. So, and the community will help, and I'm really sure need to be, because people are very bad in say that they are in trouble. So, or if they need help. So just ask help, and I'm 100% sure that the rural health community will help. Or in the interview.
All right.
Back
okay. So it was breaking up, but from what we could hear, you were basically saying that it's important to get help and to ask for help and not to feel isolated, because it's really important that you surround yourself by people who can help you, and people are eager to help. So it's just about asking, and I really think that you'll get the answers that you're looking for the more that you ask. So I see that the Rural Health Conference has their hand raised. Sure, you can go for it.
That's me, Bukhari. Listen, I have to go to another meeting, so I'm handing
right.
over the hosting to Armand, who is hopefully in the room there. But we just have to do a very quick poll, which I'm a bit hesitant to put up now because the Wi-Fi has been so bad. But if the online people will just do this, it takes literally 2 seconds. If everybody online will just answer those questions.
Thank you so much, Steph. All right, so while everyone is answering that question, I'd just like to hand over now to Prof. Reed, who will just be giving us a very short, keynote on inspiring you to go into rural. I see that we're already at 5:30, and this session was meant to be from 4:30 to 5:30, but there've been quite a few delays. So Prof, maybe you can just, I don't know if you're joining online or if you're physically connecting from the venue, but if you could hear us, we'd really love to hear your keynote. So Prof, you're mute. Oh, yes. Okay.
Okay, so you're asking me to talk.
Yes, yes.
She asked me to. Yeah, I just wasn't sure. It was breaking up, but I think we must close soon.
All right.
So I'm in the same room, but I'm just on my laptop. So here's the rest of the room, by the way. And the main thing seems to have collapsed.
Okay.
But I wanted to tell a story, maybe to finish off with, which was that when I was a student, I wanted to be a hand surgeon. So not just a specialist, but a subspecialist, because I trained at UCT. But I was conscripted to military service, which I didn't think was a very good idea. So I opted for non-military service, which meant 6 years of compulsory community service. So you guys do 1 year. I had to do 6. And I think in retrospect, it would have been easy to see myself as a victim of a terrible political system and all of that. But we found ourselves, my wife and I, in a rural area in KwaZulu-Natal, and we actually really, really enjoyed the work to the extent that we stayed after the 6 years, we stayed on. And I think the 3 things that I didn't before we started was it's a language than you think if you're open to it. Bahlengas and bangifundisile, and I think this family which
All right, Prof, it seems that we have lost you. I'm not sure if you can hear me, but we only managed to hear like the first part of the story, short, sadly. But I see that it's back online at the venue, so yours must be connected as well. So we can hear you now.
Okay, but I think I'm finished.
All right. So we only managed to hear the beginning of that story, but from what we got, you were on, from what we got, we can pretty much put it up and make up the rest with our own imagination. But thank you so much for sharing. Unfortunately, we are out of time, and it really was a pleasure to hear from all the panelists today and from you as well, Prof. But most importantly, thank you so much to all the students who were able to join. I really don't want to take up anyone else's time more than we have, but I've just posted in the chat that we are planning on compiling a small digital booklet that has, some tips and tricks that we got from our panelists today, just something that you can carry with you wherever you go, something that's very easy to look at. Yes, so I've set up like an Excel spreadsheet where you can add your email address, and then we'll send it to you once the digital booklet is available. But it will basically just be everything that you heard from our panelists today in like a written format. So if you are interested in getting that, please may you add your email address to the Excel spreadsheet. And thank you so much once again to all our panelists. Thank you, to Warren, thank you to Cameron, thank you to Dr. Floss, thank you Nompumelelo, thank you Anna, and thank you so much Prof. Reed, and thank you so much to everyone who joined us. And please may you continue to engage with rural health. You know, the Rural Health Conference is still ongoing for the next 2 days. So hopefully network allowing, you can connect online, but for those that are physically at the venue, I really hope that you're able to connect with everyone who's there, to connect with the different health professionals, and to connect with rural health as well. So thank you so much to everyone, and take care.
And thank you, Valerie, for coordinating it and for being such a good chair.
Thank you so much. Bye.
It's kind of like